Hello and welcome to today's episode of the Pediatric Consult. I'm Dr. Paul Bunch, your host for today, and I'm very excited to talk to today's guest, Dr. Kristen Reilly from the Division of Adolescent Medicine here at Cincinnati Children's. Today's discussion is about an often difficult topic, but very important. We're going to consult Dr. Reilly on substance use and abuse, particularly in teenagers. So thank you for joining us today, Dr. Reilly.
Thank you so much for having me.
Just to let our audience get to know you a little better, can you tell us a little bit about your background, where you're from, where your training was, and any interests outside the hospital?
I'm originally from upstate New York, but I did my pediatric residency here at Cincinnati Children's. And then I went on to specialize in adolescent medicine and with an emphasis on substance use disorders over at Nationwide Children's. And then I took a faculty position last August, so I'm back in Cincinnati. And in terms of interests outside the hospital, I've gotten into running recently and did the half marathon a few weeks ago, which was really fun, really
That's
challenging,
awesome.
but it's a great way to blow off steam from a job that can be sometimes very challenging, but certainly very rewarding.
Well, thank you so much for joining us. To get started, I wanted to ask some questions just about substance use at a high level, what we know about the rates of substance use in teens, how that might have changed over the years. So, currently here in 2025, what do we know about substance use rates in teenagers?
Sure. And so while there are kind of new substances that are being developed every day to circumvent some of the laws and regulations, the substances that are being most commonly used by adolescents have remained the same over the past several years, and that's nicotine, alcohol, and cannabis. And we saw during COVID, all substance use in teenagers actually going down. And then in the past few years, that has actually started to tick up again. And what we're seeing is that, particularly in states that have legalized cannabis, we are seeing higher rates of cannabis use in teenage populations. And then the other thing to note is that over time, alcohol use has actually gone down quite dramatically. And so really the substances that we see most commonly in our clinics are nicotine, particularly e-cigarettes or vaping, and cannabis use.
And the rise in cannabis use in those states with legalized use, do you think that is more ease of access or changes in social norms or both?
Yeah, it's definitely both. It's certainly easier to get products that contain cannabis, whether they're from dispensaries or even drugstore or like gas station stores that can have synthetic cannabinoids. And then also just norms have changed. People are thinking that THC is a safer alternative to other substances. And so teenagers are doing the same risk assessment that we're doing, but it may not be exactly the same way that we would approach it. And so we know from data that when teens see THC as being more risky, they are less likely to consume it. So it is our job as pediatricians to highlight the risks of cannabis and THC use in teenagers.
And are there any particularly impactful ways to address that with teens?
I think having these discussions early in clinic visits can be really important. So the AAP does recommend that we start universal screening of substance use in all adolescents at well-child visits. And really, the bulk of the patients that you'll see in primary care either have no use or episodic or what we call risky use without necessarily a substance use disorder. And what we want to do for the teenagers that have no use is to really validate their decision not to use, because we know that the longer that we can delay substance use onset, we're able to prevent a lot of problems down the road.
And what age does the AAP recommend that?
In general, around age 12 can be a good time to start with to asking these questions.
Okay, which obviously seems like a very young age, but I think it's nice because that opens the conversation that this is something we're going to be talking about when you come to see us. What age, when you look at the data, is kind of an average age of onset of these various substances? Is that out there? Is that known?
Yeah, it differs between the different substances, and I think when we start asking these questions, even in these young ages, it's important to educate the teens that we see that regular use is actually not the norm. Most kids aren't using regularly, and that telling them that when we're screening, we're not screening because we're expecting them to be using substances, but rather just being able to educate them if they are being exposed to these substances. And I think with the younger kids, a nice way to start off these conversations is really asking what their friends are doing. Or are there people at your school that are doing this? Are your friends doing this? Is this something that you've tried?
Okay. And then looking over time, there's a youth behavior risk survey that the CDC does every couple years. I remember doing that in high school 20 years ago. What do we know about like changes in use? You talked about the more acute, the last couple years, between COVID to now, but, even looking 20, 30 years ago with use of nicotine, alcohol, cannabis, things like that.
We know that alcohol use over the past 20, 30 years has gone down, particularly binge drinking in teenagers, which is excellent. And then the use of combustible cigarettes has also gone down substantially, which is really largely the result of a lot of anti-smoking efforts, public health efforts. But unfortunately, in 2017, Juul entered the market. And so the use of vaped cigarettes or e-cigarettes has really taken off. And so that has become much, much more common. And then since the legalization of THC products, both with medical cannabis and recreational cannabis, we've also seen increases in that usage as well.
Okay. And have you found an effective way in the clinic to talk about e-cigarette use, Juuls, vapes, when it comes to like health risks? I think it's very easy to talk about the combustible cigarettes, the cancer, heart disease, all the, throat and mouth cancers, lung cancers. That's very easy, and a lot of kids and then parents especially can visualize those things. But the e-cigarettes, the vapes, have been somewhat marketed as more safe. Now that doesn't mean they're safe. That just means they're maybe more safe.
Right.
So how do we navigate that kind of tricky conversation?
Yeah, and these companies market their products as vaped products. And I think that's to imply that it's harmless water vapor, and that's really not the case. We know that there are a number of health risks associated with e-cigarettes. They may not have exactly the same health risks as combustible cigarettes, but we still see this cardiovascular risks, insulin resistance, and lung-related injury. And then there is a specific type of lung injury that's just from the vaped product itself, even aside from the nicotine. So I think it's still important to educate our teens that these products are very dangerous, and the fact that they have nicotine in them does make them addictive, and nicotine is the product that's most likely, users of nicotine are the most likely to go on to develop a substance use disorder.
And then kind of also on the safety and how we can educate our patients. When it comes to THC, marijuana, cannabis, again, it's kind of developed this like, oh, it's not that dangerous perspective. With legalization, that doesn't help that perspective. Is there any kind of jewels that you can give or pearls you can give to our listeners of like, how do we talk about the risks that come with THC?
Yeah. For cannabis products, the risks for teenagers, for youth, compared to adults is very different, just because the teenage brain is still developing. And so when teenagers are exposed to substances over time while their brain is still developing, it makes them more likely to develop an addiction to the substance. We know that the earlier they're exposed to any drug, the more likely they are to become addicted to it. And so that is one risk in and of itself. And then in addition to that, continuous cannabis use can lead to neurocognitive problems. So research has demonstrated a drop in IQ among regular cannabis users. We do see an increase in anxiety disorders, in particular social anxiety disorder. There's an increase of psychosis and psychotic symptoms in people who regularly use cannabis. And then there are a number of psychosocial issues that can come with people that use cannabis just because they are less likely to do well in school and participate in extracurricular activities that can have consequences down the road. And so the safest thing for teenagers is really not to use.
That's great, because that's, just fighting that image that because it's legal, it's safe. That's challenging. And obviously, alcohol is a good example where that is legal, but it's, when used incorrectly is definitely not safe. So kind of making that connection that there are definitely, psychosocial, neuropsychiatric, social complications that come with that is very helpful.
And it can be very tricky just because both cannabis products and nicotine products are marketed towards children. We see, especially in THC edibles, they are packaged to look like candies that you would buy like in the grocery store. And the same thing with vaped tobacco or vaped nicotine. The products that are currently on the market are designed to look like household products or ones that it can be very easily hidden, like palmed up the sleeve, or to look like, highlighters or hand sanitizers. So they're really designed to be used by teenagers and hidden because they look like household products. And so I think it's really just incumbent upon us as pediatricians to provide this education.
So very helpful. Thank you. Let's take it back to the clinic. We're seeing a teenager for their annual well visit. And we want to screen them for lots of different things. The Bright Futures gives us 1,000 things to talk about in every visit, but I do think this is a very important thing. What steps or what tools would you use in the clinic, starting with the validated screening tools? Which ones are out there? Which ones do you like? How do we use them?
There are two screening tools that I see used most commonly. The first is called the S2BI, and that's screening to brief intervention. And it is a brief screening tool, which is nice because I definitely hear you. We do see screening fatigue among patients. And the S2BI asks 3 questions. It asks, have you had any use of nicotine products, cannabis, or alcohol? And then if they have any use of any of those substances, then it goes on to ask about other substance use. And then in addition to if they have used these substances, it asks the frequency. And so based on the result of the S2BI, it guides you on how to intervene. So if there's no use, you want to validate that. And if it's episodic use, you want to provide a brief advice. So you talk about kind of the dangers of continued use and how to reduce their risk. And then if it is more continuous or regular use, where you suspect that there may be a substance use disorder, you can do a brief intervention, which is using the principles of motivational interviewing. So trying to understand why they're using and what goals they have for the future and how they may not exactly align. And then if you still have concerns about their use, the next step would be referral to treatment, and we can talk a little bit more about that. And then the other tool that I really like is called the CRAFT. And so the CRAFT asks 5 questions around the context of their use. If they've ever driven in a car while they have been using or with someone else has been using. Do they use substances in order to relax? Do they have their friends or family ever told them to cut back? Have they ever forgotten about something when they've been using? And have they ever gotten in trouble because of their use? And really what this gets at is if they have continued to use substances despite some of these consequences, which places them at higher risk of having a substance use disorder.
Yeah, in our office, we've started doing the craft about 6 to 9 months ago, and it's been interesting. It kind of opens the door to that conversation. And ideally, we're going to have reviewed that before we go into the room or right at the beginning of the visit to kind of give us a roadmap. But, it's still important to have that conversation, I think, with every kid. And as an adolescent medicine doctor, you're the master of the HEDS exam. Any pearls of wisdom on how to do a good HEDS exam, particularly around substance use, but just in general?
I think talking about confidentiality at the outset is really helpful. So for substance use, you want to explain to the teenager that the conversation that you're about to have is confidential, in that you aren't going to tell the details of the conversation with their parent unless they want you to. Mm-hmm. And also, we don't encourage secrecy between our patients and their parents, but we also understand that they may be more willing to have an open conversation with us without their parents present. And then also talking about the limits of confidentiality. So if they disclose something to you that makes you concerned about their safety, then you would have to explain to them that you would have to bring the parent in. And then the other thing about the HEDS exam, particularly when talking about substance use, is really coming from these questions from a place of curiosity rather than judgment. Because if they feel judged, they're not going to talk to you and not really going to want to open up and have an open conversation about these things.
And do you have an example of how to ask these questions non-judgmentally, how to open that door? Like, how do you do it in your clinic?
I generally start with the part of the social history that's easier to talk about. How, who lives at home? How is school going? It's kind of things that are just easier to answer. And then in talking about substance use, I generally ask what their friends are doing, what's available at school, and then talk to them about what their own experience has been. And these conversations are easier the more you get to know the patient. And so it's the more continuity that you have with a patient, the easier these questions become.
So anytime we ask a question in clinic, we should be prepared to respond to any answer. And, when we get those positive responses that, yes, they are using substances, what is our best next step as far as how to assess the frequency and severity of the use, and then how to counsel them with next steps?
So for patients that are using kind of more episodically, where you're not necessarily concerned about an addiction, it's really important to talk about other risky behaviors that can be happening with substance use. So first and foremost, making sure that they're not driving. And then, if they're using during school, that is a huge risk factor for, multiple school problems. So just trying to understand kind of their context around their use. And then understanding kind of why they're using and things that they want to achieve in the future and how those are really can be at odds with each other. Or even things that are going well now, kind of how that may not continue if they continue to use substances. And then for patients that are using more regularly, like you mentioned, somebody who's using using cannabis on a nightly basis, that may be a signal that they have an undiagnosed anxiety or depression. So trying to kind of tease that out, because that's something that can certainly respond to treatment. And then at that point, if it becomes a regular use, referring for treatment, it would really be appropriate. And so referring them for mental health services is kind of the first and the cornerstone of substance use treatment. And then for some people who have a substance use disorder, there are medications available for treatment, and there are specialists who are available to provide those.
And, for the substance use treatment, other than the medications, what does that usually look like?
It can look a lot of different ways, kind of depending on the severity of use. So there is outpatient treatment, which tends to focus on increasing motivation for change. So a lot of the work is around motivational interviewing. And then also cognitive behavioral therapy is used fairly commonly. For more severe substance use, there are kind of more intensive substance use treatments. So that would be intensive outpatient, your IOP, partial hospitalization programs. That's your PHP, and then there is residential treatment available for patients. And so it really just depends on kind of the severity of use.
Okay. And, of course, all of my patients are always going to tell me the truth, but I hear that teenagers sometimes don't tell us the truth when we ask them questions. So are there other signs or symptoms that, either the parent might report or might even come up in the course of conversation, or even just physical signs that we should be on the lookout for?
So if either you or the parent is really noticing kind of changes in their behavior that are concerning, like not doing as well in school or loss of interest in activities that they used to really enjoy, if parents find that they're being a bit more sneaky or secretive around their phone use, or potentially like changes in eating habits. So all of those things should really raise the red flags. And even if a patient is not 100% truthful in their substance use, we can still talk to them about substance use and the risks associated with it. And then for therapists and in our clinic, we understand that their motivation for change can be really low, and we expect that. That is developmentally normal for adolescents, and so that's something that we're very used to talking about.
And, while we're waiting for a patient to get in with a substance use treatment program, or maybe their family or the patient is resistant to doing it, what kind of things can we do as a primary care provider to get them on a better path, to help them to, address this?
I think regular follow-up is important because the relationship between the provider and the patient, it can be one of the most, powerful motivators for change. And then treating underlying mental health conditions can also be really helpful. So if they're using, for instance, cannabis because they have a lot of problems with sleep, trying to address sleep. That doesn't mean that we don't want to work on the cannabis, but we know that if we address sleep first, that's something that we can work on down the road. And same thing with anxiety or depression and that sort of thing.
Okay. And then the role of testing. It's a very tricky conversation. Actually, one of my partners last week got a call from a parent asking him to do drug testing for their child. And, I'd like to hear your thoughts on the role of that, both as what we would do as a provider, what we would ask parents to do, or talk to parents about that decision whether or not to do a urine drug screen, which they can buy at the pharmacy. What is your kind of general advice on the role of urine drug screens?
This certainly does come up a lot. And I think the most important thing to talk to parents about is really the limitations of urine drug testing. They're not perfect, and they are riddled with false positives and false negatives. And the half-life of a lot of these substances isn't very long. So if you do a random drug test, you may not capture kind of all substance use. So it's not, I don't think they're particularly accurate for kind of just random use. I think they can be a really helpful tool in the context of substance use treatment by a medical professional, but I don't necessarily recommend doing one for disciplinary purposes, which is why a lot of parents are requesting one. And it's understandable, and we can certainly, validate those concerns. But really what we want to do is to address the concerns that they have, like why they're worried about the substance use rather than the actual urine drug test.
Yeah. And I feel like, at least on the primary care side, it seems like we're violating their trust, that we're saying, I believe what you're telling me, but I'm also going to double check and do a urine test, and that just feels a little uncomfortable and
Absolutely.
seems like it erodes the relationship a little bit.
Yeah, absolutely. Because really, as their provider, you want them to feel comfortable talking to you, and if they feel like you don't trust them, then those lines of communication are going to just be very closed off. And so for that reason as well, I really don't recommend these random urine drug tests in the office setting.
And then some high schools have actually been doing routine random drug screens on students. Do you have any thoughts about that, or know of any data about the utility of those kind of tests?
I don't. I think that is interesting. I know outside of substance use treatment, I think that it can become tricky. But, employers use urine drug screens. So, I do think it's important to talk to kids who are using substances that they may have to provide urine drug testing for their jobs. And so this may just be another place where they would have to submit a urine drug screen.
So when we've talked about risks for substance use and comorbidities, we've talked a lot about mental health disorders like anxiety and depression. Another mental health condition that seems to raise risks or change risks of substance use is ADHD. Anything that you can talk about when it comes to substance use in patients with ADHD?
It can get really tricky to treat ADHD in patients who are using either drugs or alcohol, but we know that untreated ADHD is a big risk factor for the development of a substance use disorder. So it's really important that they still continue to get treatment. We know that stimulant medication tends to be the most effective, but pediatricians are rightly worried about the risks of diversion or misusing those medications. So in my practice, I still do prescribe stimulants, but it's better to use the long-acting stimulants. And then Vyvanse in particular is a good medication to use because it is longer acting, and there is it has to be metabolized by the gut in order for it to be effective, so it can't be snorted. The other thing is that if you do prescribe stimulants to teenagers who do use other substances, it's important that the parents be in charge of medication and that you have regular follow-up. And so even if you're treating their ADHD, it's important to still address substance use.
And then going a little bit off topic, kind of from a different angle, sometimes with even younger kids that we're talking about starting a stimulant for, parents will express risk or concern of risk of inducing a substance use disorder. Like, are we giving them these addictive medications? What are those risks, for a child with properly treated versus untreated ADHD when it comes to future substance use?
So we know properly treated ADHD will decrease one's risk of developing a substance use disorder later in life. And so it's important to treat the ADHD adequately, and whether that's medication or behavioral interventions, really ideally a combination of both. It's still important to provide those treatments.
Great. Well, thank you again, Dr. Reilly, for joining us today. I've definitely learned a lot about how to talk to the teenagers I see in my office, how to address those positive questions, because that's usually the most challenging part. A reminder for our listeners, today's episode is available for CME. You can find a link to that in the show notes. And today's discussion was really guided by the community practice support tool that you can find at cincinnatichildrens.org or on the PCP Community Tools app on your phone. So, Dr. Reilly, thank you again, and I hope everybody has a great rest of their day.
Thank you so much.